The spider is an animal that fascinates, but at the same time frightens. He carefully weaves his web, waiting for his prey to get trapped in it. Their long, swift legs, and the potentially dangerous bites of some species can be frightening and intimidating to many people, such as those suffering from arachnophobia. But what happens to your body if a poisonous spider bites you? Almost all spiders, with a few exceptions, produce poison, which is intended to immobilize prey. The content of this poison varies enormously from species to species. Spiders do not usually bite, and if they do, in most cases, the effects are not serious. It is a dry bite, or with a small amount of inoculated poison, which has the sole purpose of driving away the person. In case one of the most poisonous spiders bites you, the situation changes. The spider injects its venom into humans through its mouthparts, particularly from the two chelicerae. They consist of two segments each, the fang and the basal segment. When the spider bites the man, it uses its fang to penetrate deep into the skin, as if it were a hypodermic needle, and lacerate the victim's flesh. The basal segment, on the other hand, includes specialized venom glands and the constricting muscles that surround them. When the latter are voluntarily contracted by the spider, the venom glands compress and cause the release of the poison, which through the fangs is injected into the wound caused by the bite. Some spiders have such an amount of venom available that if inoculated into humans, it can have fatal consequences, such as death. Spider venom is a blend of over 100 components. The synergistic action of these components makes the poison toxic, which once injected, acts on various targets, including receptors, mostly located in the muscular and nervous systems. The complex of morbid phenomena produced by the bite is known as arachnidism. Often, the spider bite is not immediately felt. After 2/6 of an hour, there will be pain at the site of the bite, redness, swelling, and a decrease in sensation. They can be associated with systemic symptoms, such as fever, nausea, headache, dizziness, and sweating. In the 24 hours following the bite, symptoms tend to get worse. The severity depends on the species of arachnid that bit us and the amount of venom injected. Some bites can leave wounds so large that they cause infection or carry infectious bacteria that were on the spider's fangs at the time of the bite. The venom of spiders is divided into two types. Neurotoxic attacks the nervous system. Necrotoxic attacks cells and destroys tissues surrounding the wound or internal organs. An example of a neurotoxic venom is that of the black widow, which has alpha-latrotoxin, a protein component of the venom, capable of causing the release of acetylcholine. It is one of the most important neurotransmitters, responsible for the nerve transmission of the central and peripheral nervous system. Following the bite, acetylcholine stimulates muscle contraction and causes abdominal and muscle cramps, similar to tetanus-induced contact and respiratory system problems. The neurotoxic poison is spread through the bloodstream, causing toxins to deposit in the chemical synapse between nerve and muscle, called the neuromuscular junction. It thus acts on the nerve endings, preventing muscle relaxation. Neurotoxic venom can prevent proper communication through the synapse between neurons, altering the transmission of the impulse along the nerve fiber. An example of a necrotoxic venom is that of the violin spider. The effects on humans are highly variable. Mild symptoms, such as nausea, vomiting, and fever, may be felt. After 2 to 8 hours from the bite, the area begins to itch, and in the following 12 to 36 hours, the pain becomes acute. As the days pass, the injected toxin causes necrotic ulcers that destroy soft tissue, risking gangrene. It is a disease that occurs following a blockage of the blood supply to one or more tissues, which undergo necrosis. The wound can widen up to 25 centimeters in severe cases. Among the most serious effects are renal failure, hemolysis, process of destruction of red blood cells, disseminated intravascular coagulation, blood clots form throughout the body, blocking small blood vessels, up to respiratory and cardiac arrest.